We are moving on to, and this sounds terrible, the addiction panel, but we want to look at the effects of TM on those with addictions.
I think I had my first drink when I was about 12 or 13 years old. I have extreme anxiety and depression. I was a closet drinker, so I don't think anybody ever saw how much I drank. From 21 on, it got like really bad. You know, my marriage was falling apart, my relationship with my family, and I just couldn't take it anymore.
This last time when I went out and drank, the consequences were pretty horrific. After I came to in the hospital that I had to go to rehab, this is not my first time in rehab. I was on medication before for my depression, anxiety, and to stop the craving. And obviously those didn't work.
We know that stress and craving really plays a critical role in the relapse process. So anything we can do or offer patients to help mitigate some of that can be a very positive thing. And I see meditation in general and TM specifically as having great promise in relapse prevention.
So I've been sober, I think, 6 months now, and meditating for 5. This is the longest I have been sober outside of being pregnant. Building my sobriety has been amazing to me, and I think a huge part of it is because of my meditation. It takes me to a certain part of relaxation that I didn't even think was possible.
Since I started doing the meditation twice a day, I haven't had any cravings. Meditation has helped me to realize I don't have to act on my thoughts. Now, instead of thinking of drinking, I say, yeah, I don't have to drink. This is the best I've felt for many, many years. We're talking decades.
So the overarching purpose of this pilot study was really to determine the feasibility of integrating TM into alcohol use disorder treatment. And that's something that we demonstrated very well. At the 3-month follow-up, we asked patients how often in the past 30 days have they practiced TM. Over 80% of the patients reported that they meditated on at least 25 of the past 30 days. That kind of adherence, whether you're studying a medication or a new behavioral treatment, adherence is often really the Achilles heel of any kind of new intervention.
TM not only is helping with their stress levels, but also with these levels of decreased depression and anxiety, the decrease of cravings.
We in the addiction field need all the help we can get in enhancing our treatment, and I would like to see this become part of mainstream addiction treatment.
There's always an opportunity for transformation, even for people that have been struggling with this disease for many, many years.
Meditation has significantly helped my recovery, and I think it should be taught in every rehab facility there is.
I went through a really dark time in my life where I didn't want to wake up in the morning at all. Now when I wake up in the morning, I feel happy, I feel blessed. The one regret I do have is that I wish I went earlier, just so I could have had that much more of my life back.
$25 million Americans. 25 million Americans suffer from substance use disorder. The problem is worsening. It's being exacerbated by our stressful society and by the inability or the ineffectiveness to be able to address some of the fundamental causes of addiction. And we are making a transition. We've been talking about military. This is obviously a big problem with post-traumatic stress. We are very fortunate to have, again, 3 extraordinary people who are leaders in the field of the work with Transcendental Meditation for recovery from addictions. And they are now working with the new center within the David Lynch Foundation, the new Center for Excellence in Recovery of Addictions. And our 3 panelists are Elizabeth Cairns, who's the Executive Director of the Peter G. Dodge Foundation, which is a philanthropic organization that helps people lead lives free from the effects of alcohol addiction. Jan Gryczinski, who is the senior research scientist, we just saw him on the video, at the Friends Research Institute, where he studies the delivery of health services for alcohol and drug addiction in various settings and contexts. And finally, Cindy Feinberg, who is a CPC and CAI president and the recovery coach, and she treats clients with substance abuse and maladaptive behaviors. She's a faculty lecturer at Adelphi University, and she's also on the board of advisors of the David Lynch Foundation.
Let me start with Cindy. I'm going to go micro and then macro. So in your practice, where have you seen the difference between a patient or client that does practice TM and a client that does not?
So in my practice, I'll just give you a little bit of an overview of the types
I'm going to ask when you answer questions.
Sure.
Yeah.
The types of people that I do see. I see people who struggle with substances, people who have mood disorders, and people who have some maladaptive behaviors, whether they're struggling with daily schedules, getting out of their house in the morning. I mean, some of the psychiatrists that I work with say, my client lies all the time. Can you help them with that? And so the running theme that all of these people struggle with is a chaotic mind, right? And so I need a lot of tools in my toolbox to help them with this. And so Transcendental Meditation is one of the best tools that I have for that. I practice TM myself. It's changed me drastically. I am in recovery myself. At some point here, we can talk about how that has changed me. And so for the clients that I work with that agree to try, because I have to get their buy-in on that, what I see the difference is the peace that comes over them. And I like to liken it to hitting pause before you send out that email that you might not want to send, right? So it's taking that space to be able to make a decision before just acting on it. Because for somebody who has a substance use issue, they tend to act impulsively. And I can speak for myself before I found recovery. It's that impulsivity that they need help with. And TM really does help with that.
Elizabeth, the Peter Dodge Foundation can spend its money in any number of ways, I'm sure, that you get a lot of people looking to help fund research. Why TM?
Well, it starts with our founder, Peter Dodge, who is himself someone who struggled with finding the right treatment for his alcohol addiction over years and trial and error. He was someone who, AA, the Alcoholics Anonymous, was sort of the dominant, mainstream treatment for alcohol addiction, was not a good fit for him. He tried it and tried it and tried it and just found that he wasn't able to stay sober with it and was sort of set adrift. And so over the years, he cobbled together, I liked what the gentleman on the veterans panel said, using all the tools in the toolbox. He cobbled together this toolbox of ways that he approaches his own addiction. So he takes medication and he goes to counseling and he exercises. And it turned out that TM was something that worked extremely well for him. He found that he was transformed by it. And the anxiety that he had and the need to kind of constantly be thinking and thinking and thinking calmed down. And it has helped him stay sober, as a part of a program. It's not the only thing he does to stay sober, but it's as something that augments the way that he stays sober. It's been really important. So when we started the foundation, it was, our first thing that we tried to do was, first of all, let everyone know what options are available. So we set up a treatment guide on our website with, not just AA, but all the mutual help groups, information about inpatient, outpatient treatment, information about counseling, information about lifestyle changes, including meditation, including, a whole variety of things, and also, details about medications that are available. So the idea would be to kind of educate everyone about what they can do when they're looking for treatment for themselves or a loved one. And because TM had been so effective for Peter, when we started our grant program, We tried to be kind of diversified, and we gave grants to a number of organizations that are doing great work in the field. But for our first scientific research grant, Peter was like, let's find out if TM works so well for me. Let's find out if it can be applied to this broader population. So we looked into research that already existed. There was some that was promising, and it was kind of dated, like it had stopped in the 90s. So I called up BLF and said, I know you guys do research on TM, and I know this is your thing. So what if we did a study? What if we did an updated study? Do you see a need for that? And they said, great. And that's where we are. We then partnered with Friends Research Institute, and the study went forward, and Jan can tell you all about that.
Right, which brings us to you and the study that you've done. Tell me what you were trying to find out when you set up the research, and what did you find out?
Sure. So when we were first approached by the David Lynch Foundation and Peter Dodge Foundations, I didn't know anything about TM before, so I was completely new to this whole area. But the more I learned, the more fascinated I became. Because we know that stress plays such a critical role in that vicious cycle of stress, craving, and relapse. And even in our most evidence-based treatments for alcohol and drug addiction, relapse rates are very high because it's a chronic and relapsing disease. So to the extent that we can give patients these tools to kind of extend the gains of treatment, could have some tremendous public health ramifications. So we were very excited about that and the potential of TM to play a role. The research that was already out there was promising, but it was dated, and it didn't really speak to the issue of how do you integrate TM into the contemporary treatment environment that exists today. So we did the study. We decided we would do a pilot study to hopefully lay the groundwork for future, more rigorous randomized controlled trials that would really move the field forward and spur adoption of this technique if it proves to be helpful. But the first step to doing that is to do a pilot study and kind of learn what we don't know. So we did the study in an inpatient alcohol treatment facility in Rockville, Maryland. And the course of treatment is typically 4 weeks in residence. The first week, patients go through a medical detoxification and then followed by fairly intensive behavioral and multidisciplinary treatment for alcoholism. We did it with 60 patients who were there primarily for their alcohol use disorder. And 30 of them learned to do transcendental meditation from certified TM instructors that came into the facility, and we really integrated it into the patient's treatment experience. And then 30 other patients comprised our treatment as usual comparison group. And so what we were really trying to find out is, one, is doing TM in a setting like this and really teaching it, is it feasible and is it acceptable? Because even though TM is a technique that's very easy to learn and easy to practice for the individual, it's not something that's easy to teach. It's not something that you can learn from a book, and you really need to do, to learn it. It's taught in a very specific and very structured way. So we wanted to know, can this technique, the teaching of it, really fit into the treatment milieu? Will patients sign up? Will they, be interested? And then will they meditate? Will they actually do the recommended TM practice? And we followed both groups, the treatment as usual group and the TM group, for 3 months after their discharge from the facility. So we wanted to see, about feasibility and acceptability. We also, of course, even though we knew the study with such a small sample would be underpowered to detect differences, we wanted to see if, as a group, people in the TM group, would do better in their outcome as compared to those who got usual care. And finally, we were interested in looking in more granular detail about what we kind of referred to as a dose-response analysis. In other words, do people who are more adherent to the recommended TM practice of meditating twice a day for 20 minutes, do they tend to have better outcomes than those that are less adherent? And so our findings in terms of feasibility, I should preface this by saying this is kind of hot off the presses. We just finished our data analysis. This hasn't been peer reviewed yet. So everything I'm telling you should be considered like preliminary at this point. But with that caveat, I'll say that the feasibility findings it's difficult to imagine them being more supportive of doing TM in this facility. It was highly acceptable to staff. It was highly acceptable to the patients. The patients completed the training. They were eager to sign up. And as I mentioned on the video that you saw, there was a very high level of adherence even 3 months after leaving the facility to TM. And patients reported high levels of satisfaction. They reported that they found TM to be very helpful in managing their stress, managing their cravings, and avoiding relapse to drinking. So that was very encouraging. In terms of the group difference, again, the study's underpowered. What we found was that patients in both groups tended to have substantial improvements on a variety of outcomes that we measured, including various measures of stress, craving, psychological distress, functioning, quality of life, and alcohol use, quantity and frequency behaviors. And we found that the groups improved in similar ways overall, which isn't terribly surprising because all of these patients were completing a fairly intensive course of treatment. Now, when we started looking at the dose response analysis, things got really interesting. What we found was that there were statistically significant correlations between frequency of TM practice and adherence, and outcome and more positive outcomes across a range of domains, including stress, craving, psychological distress, and actual alcohol consumption. This is kind of an interesting tidbit. We also asked patients who were in treatment as usual, if they meditated at all at follow-up. And this was, these were patients who didn't learn TM. This wasn't TM practice that they were meditating, but they may have learned to do some form of generic meditation or mindfulness, either in the program or after, or as part of 12-step work that they may have been engaged in, because meditation is featured in one of the 12 steps, as many know. We were kind of surprised to find that 40% of patients in the treatment as usual condition reported meditating at follow-up. The interesting thing was that their frequency of meditation was completely unrelated to outcome, which kind of suggests a TM-specific effect. So what we hope is that, with this study, that it will lay the groundwork for a future larger randomized controlled trial, which we're kind of working out the design details for now, and we hope to be able to kind of use that to more definitively probe, whether and how this technique can be helpful for patients undergoing this kind of treatment.
So, Norm, chime in on this a little for me, because I've heard this before, obviously, that there are many kinds of meditation. And if I'm just sitting out there and I think, well, so you need to be quiet and connect with your inner self. Like, how hard could that be? So you try some other form of meditation, right? Why is there this difference that's showing up slightly? And I realize there's not enough research, but what is your theory on that?
It's a great question. I think if you look at mindfulness, which is the other big one, and TM, mindfulness are techniques that encourage you to focus on something. Whether it's your breath, whether it's a thought, whether it's an image, focus on it right here and now. And so the goal of mindfulness really is to make people more focused on the present moment. And in general, they become more aware of what's going on here and now. The goal, if you might say, of TM is to move into this other state of mind during the meditation called transcendence, which is this kind of blissful, quiet, peaceful, lovely state with many, many different forms to it that I won't go into. But it's essentially a goal to shift your state of awareness and consciousness that then spills over into your everyday life. So one could see how for somebody with an addiction who, when their internal state gets unhappy, dysphoric, anxious, irritable, that having this place to kind of move into could protect you against choosing a substance to try and fix that unpleasant internal state. And that might explain the difference. But I'm glad you asked me to chime in, because when I hear about research and data, it's kind of like waving red meat in front of me. Anyway, so let me understand. You had a month in the facility, and then when was the last outcome measure?
We had a single follow-up at 3 months post-discharge.
And at 3 months, that's where you found a correlation between frequency of meditation and how much benefit they got overall. Now, if you took like a median cut, all those who were less than half the amount of meditation and all those who were more than, did you find a significant difference between the upper ones and the lower ones?
Very interesting question. We haven't quite done that analysis yet, but we're going to be looking at that, as closely as we can with, just having 30 subjects.
Yeah, but and I think your point is so well taken that 30 and 30, it's not really a huge number. In drug studies, they've routinely got hundreds of people, and they show a teeny difference, but because there's such a huge number, it becomes statistically significant. This sounds really very interesting and promising, given the relatively small numbers. I would feel very excited by these data.
Yes, we were certainly very encouraged, and we hope that we can really build on this. And it's not unlike other treatments, in the sense that treatments only work when you take them. Medications only work when you take them as prescribed. A gym membership is great, but it doesn't do me any good if I don't go to the gym and actually exercise.
Okay, that's enough from you.
One thing I wanted to just say, I'm glad we just talked about something only works if you do it, because I'm sure there's some clinicians here, therapists, psychiatrists maybe. One thing that I do want to say, addiction is a disease. And for years that was always very controversial. Is it a disease? Is it a choice? What is it? And it's been proven that it is a disease. And so, having said that, recovery is not easy. The person has to be willing to change everything about their life. So usually when I get somebody in front of me, they're at the point where they may have already been to 15 treatment centers, and some people may say, what, 15 treatment centers? But yes, they may have been to 15 treatment centers. So now they're willing to do anything. So yes, it requires a complete overhaul. So now I'm presenting to them, and you have to meditate. Meditation is part of your prescription. It's an easy sell. And this meditation process, Transcendental Meditation, I have to give people an easy solution. It can't be something that's got a lot of things built into it. 20 minutes, twice a day, they get a mantra, they get to go meet Bob Roth. Are you kidding me? What would be better than that? So for somebody who's got an addictive brain or a chaotic brain, it's got to be clear, it's got to be simple, there's got to be a quick solution. It can't be something that's going to jumble their mind, and that's why I love TM.
So maybe you can answer me. We heard from the veterans panel really clearly, this is not a disease. This is something that happened to you.
Right.
And we can fix this. Here, we're dealing with a disease. So I don't know which one of you researchers has the answer to this, but is it a different part of the brain that TM then hits? Because one is experiential, sort of comes from an experience, and the other comes from an actual disease.
Yes, I think one thing that unites these is there are different parts of the brain, but I think what unites them is that different parts of the brain are being selectively injured. The one is the amygdala, which is the distress part of the brain, and the other is pleasure centers, such as the nucleus accumbens, that is co-opted or hijacked by a substance, or in some cases even a behavior. There are behavioral addictions too that co-opt these pleasure centers, and so that the part of the brain that should be controlling our behaviors becomes less and less salient in the decision-making processes. And the TM in both instances strengthens by calming down the system it's less likely to shoot off that email at midnight, as was mentioned over here. You're less likely to do impulsive things. You're more likely to say, wait a sec, is this a good idea? But something, I'm so excited by these data because, as a psychiatrist, seeing the incredible human costs of these addictions, let alone the financial costs to society, anything that can make a real impact on that would be an enormous contribution.
I want to thank you all as we move on to our next panel, but especially to your foundation. Thank you so much for this. As you can hear, we've made Dr. Rosenthal's day. But I mean, it's just so important, and I know money is asked for a lot and is scarce, so we appreciate that, and we appreciate your all's expertise on this. Thank you so much.
Lovely work.